Today we will be discussing a complication of the peripheral vascular system known as a deep vein thrombosis. First, what is a DVT? Well, simply put, a DVT is a blood clot that develops in a deep vein within the body that disrupts blood flow. These mainly occur in the lower extremities, such as in the iliac vein or the femoral veins, but they can also occur in the upper extremities. DVTs can form when there is an imbalance between the formation of clots and the breaking down of clots, also known as the coagulation and fibrinolytic systems. This imbalance can be due to a number of different factors which we will be exploring shortly. The clot forms due to platelets clumping together and this protein fibrin being stimulated to collect red blood cells, white blood cells, and more platelets to mesh them together to complete the clot, also known as the thrombus. Risk factors for developing a DVT fall into three broad categories that make up Virchow's triad. The three broad categories are venous stasis, endothelial damage or vascular injury, and blood hypercoagulability. The first category, venous stasis, is also known as low flow through the veins. Some examples could be prolonged immobility when the calf muscles aren't contracting as much, which would normally assist blood flow back to the heart, pregnancy and obesity, which increase pressure on the veins, polycythemia, which is an overproduction of red blood cells that increase the viscosity of the blood, and other examples seen here. The second category is endothelial damage or vascular injury, which is when there is damage to the blood vessel walls. Causes of this could be surgery, trauma, or a personal history of having a DVT, as there could be pre-existing damage. The third category is blood hypercoagulability, which includes a number of different factors. First, you could be genetically at risk for developing a DVT with the presence of factor V Leiden, a clotting factor. There are also medications that can alter or increase your body's clotting ability, such as oral contraceptives or hormone replacement therapy. Malignancies such as cancer can affect your body's normal clotting, and dehydration, smoking, and sepsis can also increase your risk as well. An important note to remember is that a DVT can be unprovoked, and a risk factor does not have to be present for someone to develop a DVT. The most common signs and symptoms of a DVT include edema that is asymmetrical, warm, and painful, a pain to the affected limb that feels like aching or cramping, and tenderness around the affected site. It is also important to note that a DVT can occur without any noticeable signs or symptoms, so we must pay extra attention to those who we know are at risk. In terms of diagnostic tests, there are two main tests that can be used to identify and diagnose the presence of a DVT. A Doppler ultrasound is a first-line, non-invasive imaging modality that can be used to confirm the presence of a DVT quickly and easily. Evenography is an invasive test that involves injecting dye into the veins and then taking an X-ray of the veins, and the dye can be used to visualize the venous structures.
Here are a few nursing diagnoses: acute pain related to venous congestion, impaired venous return and inflammation, ineffective health maintenance related to insufficient resources, or risk for impaired skin integrity related to alteration in fluid volume. DVT is treated pharmacologically with anticoagulant therapy. It is important to note that the medication does not lyse the thrombus, but rather prevents its spread or accumulation of new clots. It's the body's own intrinsic fibrinolytic system that is responsible for clot lysis. There are also catheter-based treatment options available, such as direct administration of a thrombolytic drug that destroys the clot. This can be used in conjunction with treatments such as an angioplasty, stent placement, and/or mechanical thrombectomy. Next, there are surgical options, which involves an open venous thrombectomy and inferior vena cava interruption. Most cases of DVT are able to be managed medically, but a small number of patients may need to undergo surgical intervention. Common nursing interventions include extremity elevation to decrease edema, early and aggressive mobilization, which is also the easiest and most cost-effective way to decrease the risk of DVT. The use of compression stockings can increase venous blood flow, velocity, prevention of venous wall dilation, improvement of venous valve function, and stimulation of endothelial fibrinolytic activity. Lastly, we want to educate our patients about the benefits of smoking cessation, weight loss, exercise, and the avoidance of constrictive clothing. We can also teach our patients to flex and extend their lower extremities every 2 to 4 hours while awake. A complication of DVT includes the development of post-thrombotic syndrome, which affects up to 50% of patients within 2 years of DVT. This results from chronic venous hypertension caused by valvular destruction. Symptoms of this include pain, aching, sensation of heaviness, and much more, as listed below. A rare complication of DVT is phlegmasia cerulea dolens, which is characterized by a swollen, blue, and painful leg. This results from one or more severe lower leg DVTs that involve major leg veins causing near total occlusion of venous outflow. Lastly, it is important to note that anticoagulant therapy causes an increased risk of bleeding. Therefore, we must monitor for signs and symptoms of bleeding, such as hypotension, tachycardia, hematuria, and other indications. Thank you so much for watching our presentation. We hope you enjoyed.